Hi, my name's Ivannie, and I am an intern here at the Colorado Learning Center of Human Anatomy. Today we have really fun stuff planned for you, and we're going to start off by showing you the heart and lungs. This is a set of heart and lungs. And if you look, they're pretty big, and if you were able to hold them like I am, you would notice how heavy they were. But when you're breathing and you're moving around, do you notice your chest being weighed down? Can you feel that weight? I'm assuming your answer is probably not, right? Otherwise, our chest would always be feeling super heavy. The reason for that is because our atmospheric pressure inside of our thoracic cavity is actually less than the outside of it, okay? And that's why we don't feel weighed down by our chest, by our heart and our lungs. We feel weightless up there, right? Our stomach is a little bit different. We can feel when we eat a lot. We can feel the heaviness there, but we don't feel that up top, which is good. I'm gonna start today by talking about our lungs. And right here you can tell, they don't look that big, right? We can hold them in two hands. They're not super big, but if you were to spread these lungs out, they're actually the size of a tennis court, which is pretty amazing. That's a lot of surface being scrunched up and stuffed inside of our chest, right? And they're so important. They're so vital, obviously, to our living, right? They're responsible for our breathing. The lungs are responsible for carrying oxygen from the outside world and allowing that to get entered into our blood and circulated through our body. So we're gonna talk a little bit about the structure of the lungs first. If you'll notice, the left side is actually a little bit smaller than the right side. That's because the right side has 3 lobes and the left side only has 2. That's because our left side has to make room right here for our heart. That's called the cardiac notch. It's missing a lobe so that it has room to lay on top of our heart. Our lungs are covered in a pleura, and the pleura basically is just maybe a slimy or a slippery fluid that covers our lungs so that they can move around, they can glide, and they can breathe a little bit easier, they can expand, and that's what we want, right? We want our lungs to be able to expand and take deep breaths. So it's covered in a pleura to help them move around. Now the structure of the lungs is kind of interesting. Kind of think of it as an upside down tree. Our trachea, think of it like the trunk of a tree. The trachea is the windpipe. It's our throat. It's how we get the air into our lungs. The trachea spreads into 2 bronchioles. And those bronchioles are on either side of the lungs. And then those bronchioles split into even smaller bronchioles. And those bronchioles basically infiltrate throughout the entire lungs. And at the end of those bronchioles are what we call alveoli. Those alveoli are basically like plastic bags. And when you inhale and get air in your lungs, they fill up like that. They fill up like plastic bags. And what's happening in those is that's where the oxygen exchange happens. That's where our chemical reaction happens. That's where the oxygen is being converted. That's where the carbon dioxide is being exchanged, and it's going to be sent outside of our body. So that's where all of those chemical reactions happen. To get to those chemical reactions, you have to have blood flow. That's how we get oxygen throughout our entire body. So we're gonna move on to the heart. A full-grown human heart is about the size of a closed fist. It's pretty dense, right? And this is definitely not what you might anticipate seeing when you think of a human heart. So the heart is actually covered with a sac called the pericardium. And the pericardium sac has two basic structures, and that's fibrous structures, that's fibrous material, and it's there for protection. It's there to prevent overflowing of blood to the heart. It's there to attach to other structures so that your heart stays where it needs to be. And then it's also got a serous fluid, which surrounds the heart. And that serous fluid helps your heart glide. It helps your heart beat. All the chambers are able to move freely so that our heart can pump. So to understand the oxygen exchange and how that gets throughout the rest of our body, we have to know the blood flow from the heart. The heart has 4 chambers. It has a right atria, a right ventricle, a left atria, clear back there, and a left ventricle. Now, the atrias receive blood from veins, and that's how we kind of know where the blood flow direction is. So we have a superior vena cava which brings the blood from the upper half of our body, and we have an inferior vena cava, which brings the blood from the lower half of our body. So both the superior vena cava and the inferior vena cava flow right into our right atria. Once in the right atria, the heart pumps and it contracts and it pushes that blood into the right ventricle. To do that, it must flow through the tricuspid valve. So the valves are there to prevent backflowing into the previous chamber. Okay, so that tricuspid valve prevents the blood from the right ventricle from flowing back up into the right atria. So now that the blood is in the right ventricle, it is pushed through the pulmonary valve into the pulmonary artery, which then heads into the lungs. This is where the oxygen exchange happens that we were speaking about a little bit earlier, right? This is where the blood is oxygenized and it's now going to start flowing back into the heart, okay? So through the pulmonary veins, again, it's from the veins to the atria. The pulmonary veins lead into the left atria. Through the bicuspid valve or the mitral valve, the blood flows down to the left ventricle. Now the blood is oxygenized and it's ready to go to the body. So this left ventricle sends the blood through the aorta valve into the aorta, right here. And the aorta then supplies the rest of our body with all of the oxygenated blood. And then the cycle continues. The heart beats about 70 times per minute, leading it to be about 100,000 times a day. And it takes only about 1 minute for the blood to circulate through your entire body. So that is a lot of hard work that your heart is doing constantly, day in and day out. You know that your heart's beating all the time and you know what it's doing, but you don't realize how much work it really is doing all the time for you. The aorta supplies the blood to the rest of the body, but the heart and the heart muscle still needs that blood supply. So that's where our coronary arteries come in. This is our left coronary artery that we have dissected out. And this is our right coronary artery. So these both supply blood to the pericardium and to the heart and the surrounding heart muscles and tissue right there. So we're next going to show you the different comparisons between a healthy set of lungs and then a not so healthy. So if you notice the lobes here, if you notice the tissue here and how thick and full they are, and they're not super discolored. A little bit, but not much. But if you notice the lobes here, you can see a lot of deflation, a lot of discoloration, and a lot of deflated alveoli sacs. These lungs actually come from one of our donors named Miss Flora. And Miss Flora was 74 years old. Miss Flora actually died from complications of COPD, chronic obstructive pulmonary disease. And as most of you know, that usually comes along from a history of smoking. As you can see, like I mentioned earlier, there is tons of emphysema. And emphysema is all of this black tissue. And that comes from an obstruction of vessels so that your blood isn't being supplied well to your lungs. Everybody will show a little bit of emphysema on their lungs. It's just natural. We have pollutions in our air, we have chemicals, we're exposed to different things. So it is normal to see a little bit of black in your lungs. For example, we have Popcat's set of lungs here who was not a smoker, and he has a little bit of black spread throughout his lungs. Completely normal. But taking a look back at Miss Flora's, you'll notice that there is an abundance of black emphysema. So the biggest part of COPD and why it's harmful is that it causes you to not be able to breathe, right? You can't take deep breaths. Now, why is that, right? Because our trachea, our windpipe isn't blocked. We're still able to take deep breaths through there. There's no obstruction there. So the obstruction comes from the pulmonary arteries. And what happens is these alveoli are inflated with air, but when you exhale, they don't lose all of their air like they normally should. So for here, over on these set of lungs, you can't really see the sacs as well, but there is inflation in the lungs. They do get some air in there. And when they are released of the pressure, they go back to normal. That doesn't happen here. So what the problem is, if you have this disorder, this disease, if you take a deep breath and inhale all the way and only let out about half of your air, only exhale halfway, and then try to inhale again and only exhale halfway, and then inhale, do you see how it gets harder and harder to breathe? That's what's happening because we're not getting all of our air back from these alveoli. So next we're gonna do a little comparative heart anatomy. Like I said, Miss Flora had COPD, chronic obstructive pulmonary disease. That affects our pulmonary arteries. And as we learned earlier, from the direction of the blood flow, the heart pumps into the pulmonary arteries through the right ventricle. Normally, the right side of our heart, that right ventricle, only has to pump to the lungs, right? That's not a great distance. That's right here, it's only going right to our lungs. However, our left side has to pump to our aorta to go throughout the entire body. That's a lot of work. That's a lot of pumping. That's a long distance. In those terms, the left side should be a little bit thicker. If we look at Popcat's heart right here, the left side is way thicker than our right side because our right side normally does not have to work as hard. But if we look at Miss Flora over here, who had COPD and her right side had to work so hard to pump through that COPD, through the obstruction in her pulmonary arteries, look at her right side. It's thicker than her left side. Her left side that has to pump through your whole body. And that's why it's hard to breathe. That's where the complications start to come through. Your blood circulation's not as great. You can't breathe, you can't inhale. So now we've seen the comparison between the heart and the lungs for a COPD patient, for a smoker of many years, versus a pretty healthy set with only some environmental factors playing in there. So you should consider that the next time you decide, or if you ever decide, to smoke or, as it's popular today, to vape.